so good afternoon. My name is Tanja, so I'm going to present today this paper that talks about connection between welfare regimes and inter-age reallocation regimes, and the paper was written in co-authorship with Lili, Vargha and Jože, Sambt. So, EU countries differ substantially in their cultural and institutional settings, and also countries can usually be grouped together, as we talked already, based on their institutional background into certain welfare regimes. That's why we suspect that there exists a connection between welfare and inter-age or transfer regimes. However, the past literature that makes a link between transfer and welfare regimes was mainly focused on public transfers only. But recently, researchers have recognized the importance of also private transfers. However, then they focus mainly on private transfers only. Those who include private and public transfers are focusing only on individuals 50 plus, because their research is based on shared data that includes only those who are 50 plus, which means that they neglect the most important part of private transfers, which are transfers from young parents to their children. But some of them include public and private transfers and focus on all the age groups, but they are able to measure private transfers only indirectly. So they said, okay, if there is a small welfare provision by the state, it means that the role of the family should be high. So all those are facing with one fact, all those researchers are facing with one fact, and this is the fact that it's really hard to measure what is happening behind family walls. However, the NTA methodology enables us to measure comprehensively private transfers, also public transfers, and asset-based reallocations, so inter-age reallocations that result from interaction in capital and financial market. And we combine those countries with regard to transfer patterns into certain regimes. So the link is based on a Spink-Andersen typology of welfare regimes. So we distinguish between liberal, conservative and social democratic countries, but we exclude Mediterranean countries from other conservative countries, as is usually proposed in the literature. Okay, so first we descriptively present results for regime prototypes. These are main representatives of regimes. And then we calculate values of 5 different NTA and NTTA indicators to capture the main characteristics of different welfare regimes for 10 different EU countries. So here we can see the life cycle deficit financing or dependency financing for regime prototypes. So we define regime prototypes as countries which, based on past literature, with the highest probability fall into the same welfare regime independently of indicators and methods that researchers were using. And we can see here some main characteristics of different welfare regimes. So first of all, we can see here that in liberal countries, elderly mainly rely on asset-based reallocations. Okay, still their dependency is to some extent paid by public sector, mainly in form of public health expenditures. But on the other hand, in conservative countries, there is a higher redistribution through the public sector, so the elderly rely more heavily on public sector, not only in size, but also their net public transfers become positive earlier than in other countries do. However, of course, these high benefits have to be financed through high contributions of working age population. The importance of public sector is even more pronounced in social democratic countries, as you can see, but of course these more universal social rights have to be financed by huge contributions of working age population, which is also, so the full employment is promoted in social democratic countries and also prolonged, their prolonged participation on the labor market. as one of the main contributions of these results of NTA are actually the fact that we can distinguish between conservative and Mediterranean countries when we look at the private transfers, so this in red here, okay? So we can see that private transfers, those are transfers within household, are really important or more important in Mediterranean countries as in other countries, especially in conservative countries. And this is even more pronounced when we include transfers in the form of unpaid household work. Okay, so you can see that the difference now becomes even higher. So children mainly depend on private transfers and public transfers, and the elderly in all the countries mainly rely on public transfers and asset-based reallocations. And based on that, we formed first three simple indicators. So we are measuring the importance of public transfers in dependency financing for the young and the elderly. For the young, we distinguish between importance of public transfers in all market transfers, so private and public, whereas we also include the importance of public transfers in total transfers, so including also unpaid household work. And we can see that in all the countries, so children mainly rely on private transfers. Okay, so especially this is true in Mediterranean countries, but also in Germany, as you can see. But on the other hand, we have here at the top social democratic countries, some post-communist countries, but also Austria, for example, where there is a quite generous public system. The ranking does not change much when we include unpaid household work. However, the difference between some continental countries like France and Mediterranean countries is even more pronounced. But we can see here from these results that it's important to distinguish between different generations, so between the young and the elderly, because the ranking changes. So for some countries it changes when we are measuring the importance of public transfers for the elderly. For example, Finland now becomes more grouped together with social democratic countries, but on the other hand, France becomes more similar to Mediterranean countries and, for example, to Germany. So based on these first three indicators, we can say, okay, there exists a certain connection between welfare and inter-age reallocation regimes, but we can identify a few exceptions. For example, first one is Austria, which is usually clustered in conservative country, but we can see that here it's more similar to social democratic countries because of its generous public system. And on the other hand, for example, also Germany is always grouped together with the UK that presents liberal country and not with conservative countries. And based on that, okay, we said we should include something more, so there is an additional important characteristic of welfare regimes, which is gender equality, that it's promoted by different welfare states. So we include here also results of NTA by gender. So what we can see is, of course, that in all the countries, this is only paid market, so labor income compared to consumption, and we can see that in all the countries, females earn much less than men do, and this is even the most pronounced in liberal countries, but so gender equality is most pronounced in social democratic countries, whereas France and Spain become again more similar to each other, so they are somewhere in between those two groups of countries. And based on that, okay, we measure the gender gap in equality, okay, in a way that we measure the gender gap in economic independence by using the concept of life cycle surplus. So we compare the size of positive difference between labor income and consumption for males and for females, and based on that we measure, okay, additional indicators. But before, I would like to show you one additional thing. So if we include in these measures also unpaid household production, we can see, so this is a total production and total consumption for males and females, And we can see that, of course, the gender gap gets smaller in all the countries. But what is interesting is that we can again observe quite a huge difference between conservative and Mediterranean countries. The gender gap is still the highest in liberal countries, and okay, so it becomes a bit bigger in social democratic countries. So as I said, we measure the gender gap in economic dependence by the concept of life cycle surplus. It's always relative to the labor income in order to make these results comparable. And we can see, if first we look only at paid market, we can see that the gender gap is the smallest in social democratic countries, but also in some post-communist countries where egalitarian system was promoted as a heritage of socialism. And on the other hand, here at the bottom we have liberal countries. Again, Germany is ranked here, but what is interesting that now Austria becomes more similar to Germany. Okay, the ranking does not change substantially for other countries except for Mediterranean countries, where the gender gap becomes smaller when we include unpaid household work. And based on all these 5 indicators, so I'm showing here the same values as before, but we wanted to group those countries together into certain groups based on their low, medium and high value of indicators. So how we decided about the number of groups of countries. So we needed to decide how many groups of countries we are going to have. And we say, okay, there is a huge difference between social democratic countries and liberal countries, that's for sure. But it's somehow not really a clear difference between Mediterranean countries and conservative countries. That's why we at the end up with 3 different groups of countries. And these boundaries for low, medium and high values of indicators are based on the average value of each indicator plus minus a half of standard deviation. Okay, and based on these values we end up with 3 so different countries. First one is those with low levels of indicators. We name it liberal. We don't know if this is a correct version of name, but anyway it consists of UK and Germany. Then we have a group of countries that has medium level of indicators. We name that conservative. It includes Austria, France and Mediterranean countries, so Italy and Spain. And then we have countries with high level of welfare state or high level of these indicators. We call them social democratic, and they include social democratic countries, Finland and Sweden, but also post-communist countries of Hungary and Slovenia. And based on that we said, okay, there exists a clear connection between welfare and inter-age reallocation regimes, but as a main exception we identify Germany, which cannot be really a conservative country anymore, but it's converging more closely to the liberal welfare state. So this is more or less it, what I have to tell. I would like to just expose one limitation at the end. I'm aware that this is not the best way how to do these groups of countries, so we are already working on making cluster analysis for 25 EU countries. Okay, so thank you.
Okay, thank you. Now we have time for some questions from the audience. So I have a question for you then. What does this mean in terms of Espen-Andersen's groupings?
Yes, it's interesting. So in 1990s, when he established these regimes, he used really simple indicators. Okay. But anyway, then it was a lot of criticism, so you should include gender, you should include care, etc. But in the end, we primarily actually end up with his groups of countries, even though we included all these different dimensions. So I think that the fact that, so there was a criticism on his typology, but then they included only certain parts of transfers, or maybe they focus mainly on education or on health, etc. But when we included all of them, we actually end up, with the exception of Germany, with pretty much the same ranking.
And so your argument then is that Germany has somehow evolved over time, or
It
he
seems
was
so.
wrong?
No, I think that it's involved.
At the beginning, where you show the graphs
Yes.
from the original Esping-Andersen regimes, there seems to be that in almost all countries, even in the liberal ones, although the public sector is relatively smaller, that it's about the same size in other countries, but additionally they have more asset income in old age. Is it possible that just the public sector in these countries, also in the UK in this case, is about the same size in other countries, but they just have higher consumption levels in old age and have to cover it by...
Okay, so yes, maybe I did not express myself correctly enough, so relatively they have a higher amount of asset-based reallocations. But you are more or less right. Okay, so indeed these values, so in public transfers here are not that different among groups of countries. And this is especially true because I'm also taking the real age limit, so maybe if I would say, okay, take just 65 plus, this would be different. But I'd rather use the NTA approach of making different limits of dependency.
Time for
Please make one table before this.
This one?
This one. This one.
Okay.
This table demonstrates for me the demographic differences that exist between countries at level of structure of the population. Of course, in Italy we have a very low total LSD, financing young, as we have a very low proportion of young people. The place of Italy in last column is higher, of course, because we have a very important part of elderly, aging people. So I think it needs a standardization, considering these demographic differences between countries for comparing the different countries.
Okay, but...
Because this is the demographic results for me.
But anyway, these are per capita values, so they are already, so... But not multiplied, so I make them aggregate values by multiplying with standard EU population. So somehow I would like to get rid of this different demographic structure. And I think that I do it by using per capita values multiplied with standard population, which is the same for all the countries. So still I take into account that the elderly, so at 80 plus there are less of them than some other age groups, but anyway differences, I think the differences between countries are not captured. Or at least they are not captured so much they could be. But maybe, I will, thank you very much, I will check again.